This meeting is being recorded. I'm going to say continue. That's great.
Hopefully that's okay, Dr. Post. We want
Oh,
to
yeah.
be able to post it later.
Oh, please do. And send me the URL for it or whatever. Send me the link.
Will do. All right, so I'm going to get us started as I continue to sort of let people into the waiting room. So hello, everyone, and welcome to our Medical Ethics and Humanities Seminar Series. My name is Devin Stahl, and I'm the chair of the Bioethics subgroup of the Ethics Initiative at Baylor University. I'm really glad that you could join us. Our lecture today is sponsored by Baylor University's Ethics Initiative, the Medical Humanities Program, the Pre-Health Program, the Institute for the Studies of Religion. And today we're pleased to host Dr. Stephen Post as he discusses dignity for deeply forgetful people, how caregivers can meet the challenges of Alzheimer's disease. So during Dr. Post's lecture, please mute yourself. It looks like everyone is muted, but feel free to write questions as they come to you in the chat feature. We'll hope to have a lively discussion after he's finished. And during his talk, Dr. Post will play 3 media clips. If you're having trouble hearing them, I'm going to place a link to each of them in the chat feature as they come up. So now I'm going to turn it over to Dr. Jeff Levin to introduce Dr. Post.
Thank you very much. Dr. Stephen Post is one of the world's preeminent bioethicists, former editor-in-chief of the Encyclopedia of Bioethics, received his PhD from the University of Chicago Divinity School, and he served on the medical faculty at Chicago and Case Western, and since, I think, 2008 at Stony Brook, where he's professor of family, population, and preventive medicine, and is founding director of the Center for Medical Humanities, Compassionate Care, and Bioethics. Dr. Post is a member or an elected fellow of the New York Academy of Medicine, the Royal Society of Medicine in London, the Hastings Center, the International Society for Science and Religion at Cambridge. He's authored over 300 journal articles and has authored or edited at least a couple dozen books, maybe more. He's especially known for his work on ethical issues related to Alzheimer's. His newest book, as Dr. Stahl said, Dignity for Deeply Forgetful People, topic of today's talk, is due out soon with Hopkins. On a personal note, I've known Stephen for about 30 years, and especially got to know him about 20 years ago when he founded the Institute for Research on Unlimited Love, or IRUL, I-R-U-L, underwritten by John Templeton Foundation. I was privileged to serve as IRUL's research advisor for medicine and public health, incidentally alongside another Baylor professor, our mutual friend, Dr. Byron Johnson, who was a research advisor to IRUL for social science. And that's how Byron and I got to know each other. So in a way, Stephen is indirectly responsible for me probably being recruited to Baylor. IRUL is and remains, in my opinion, exceptionally influential in the field of positive psychology. And Stephen is no doubt responsible more than any other person in the academic world for the growth of research and scholarly writing on altruistic and compassionate love and other regarding virtues, both in a medical context and more generally. So we're so honored to have him speak with us today. So let's welcome my friend, Dr. Stephen Post, who will speak on the topic of his new book. All yours.
Thank you, Dr. Levin. That was more than flattering, and I'm grateful for it. Much undeserved, but thank you so much. And thank you, Dr. Stahl, for the backstory of getting together with me a few days ago to try to master the technology involved, because if there's a way to fumble it, I probably will. Hi, everybody at Baylor. I've been to Baylor, I guess, a couple of times. I once took a taxi from Houston to Waco because my plane was canceled. And I went through a lot of dusty little towns on some highway. I can't remember what it was, but the bill was $400, and I gave it to Dr. Byron Johnson, and he covered it with a smile. So what can I say? Anyway, let me proceed to share screen. Dr. Stahl, that's good, right? Okay. And okay. Then I'm going to hit slideshow from the beginning. Okay. Can you all see that? Good. All right. So yeah, the title, Dignity for deeply forgetful people. How caregivers can meet the challenges of Alzheimer's disease. Dementia is not a disease, it is a syndrome or a cluster of symptoms that can be caused by many, many, many different kinds of diseases. 100 years ago, I suppose, the main disease cause of dementia was syphilis in the form of neurosyphilis. Life expectancy was much lower. There were no antibiotics, so that would make sense. Now we have an aging society, and age itself is the strongest predictor of Alzheimer's, Parkinson's, vascular or multi-infarct dementia, meaning tiny stroke events in the white matter of the brain. Frontotemporal dementia, chronic traumatic encephalopathy, the kind of thing that you get if you whack your head 100 times against a wall or have concussions in football. These are not age related. There's also early onset Alzheimer's disease, which is caused by some autosomal dominant genes, the presenilin 1 and 2 genes. Again, these are not age related. The youngest case of probable Alzheimer's involved a 26-year-old gal. Everybody with Down syndrome, now that they're living to be well into their 50s and 60s and 70s sometimes. I mean, when I was a boy, people with Down syndrome lived into their 30s or 40s, maybe. But now that they're living into their 50s and 60s, probable Alzheimer's is ubiquitous. And this is a real double whammy for parents because parents take understandable pride in every developmental milestone that they reach with their kids. And then you get to a point where you see this development in reverse. So I've written a lot about the dual diagnosis of Down syndrome and Alzheimer's disease, and had a lot of focus groups on this. It's a very painful experience. By the way, Dr. Alzheimer himself did not think he had discovered a new disease in 1907 with the famous case of Augusta D., who was 53 years old. She did have senile dementia on autopsy. She did have some plaques that he could discern in her brain. But in his opinion, if we all just lived long enough, we would all have senile dementia. We would all become, if you will, a little bit squirrely. So today there are about 5 million Americans living with probable Alzheimer's. I say probable because you don't really know until autopsy. And believe it or not, even with autopsy, you don't know entirely because the markers, the Dow markers and the beta amyloid plaques are not clearly causative. They're associated, but they're not absolutely causative. And a lot of people, by the way, have a mixed diagnosis. So they'll have Alzheimer's plus chronic traumatic encephalitis, which means they may have a more stable progression and not deteriorate terribly rapidly. If you look at pretty much pure Alzheimer's, at least the best that we can discern from whatever techniques we have for diagnosis, about 3% would fit the category at age 65, and then it doubles every 5 years. We used to think that, well, when you hit 80 or 85, it plateaus, and at that point you're kind of off the risk hook. But it turns out now that we've had studies of women in their late 90s and so forth, about 60, even 70% of them have probable Alzheimer's disease. And so there doesn't seem to be any particular plateau at all. And maybe Alzheimer was right. Maybe if we all lived long enough, we would all have these symptoms. It's a little higher in the African American and Hispanic populations. In Japan, the life expectancy for women is 88 years of age, and they have the highest incidence of Alzheimer's disease in the world. Something like 12% of their population is diagnosed, and that's huge if you think about it, especially in a culture where you have relatively few births. It's a very aged society, and this has caused a lot of issues that I won't go into. And of course, for all of you, many of you are younger, listening to this, there's the matter of intergenerational justice. Really, it's extraordinarily expensive to care for people with progressive dementia. How do we balance that with the needs of young people? Or is that even an appropriate question? I don't know. Some years ago, a friend of mine, Bob Binstock, and I did a book with C. Everett Koop, who was then the Surgeon General under President Ronald Reagan. Too old for healthcare, question mark. Controversies in medicine, law, economics, and ethics. Ev Koop didn't think that he was too old. He was about 75 at the time, and he just had heart surgery. But this continues to be a big discussion around the world, and you can't avoid some conversation. Zeke Emanuel, who's at the University of Pennsylvania and is a big player in the Biden administration, is all for age-based rationing. I'm not for age-based rationing, by the way, but I realize how significant the question is. If you look historically, because you're in medical humanities, the founding utopian statement of the modern biological period goes back to Francis Bacon in 1626. He wrote something called the New Atlantis. And he envisioned all of the biological revolutionary aspects to the human future, including waters of paradise, fountains of youth, if you will. And that has always been a goal. In fact, right now, 70% of the National Institute of Aging budget is devoted to basic science on aging itself, with the goal of, in fact, either slowing aging with a compression of morbidity, or even, some say, turning it back a little bit. I don't know if that will ever be possible, but that's because so many of these chronic illnesses, the main precipitating factor of which, well, it's partly genetic, but it's largely just age itself. We're not able to master them and get a handle on them. And so maybe the ultimate resolution has to be something in the area of aging, anti-aging research that's inclusive of a compression or a shrinking of morbidity, not an expansion of morbidity. So if you look at, this is part one of my talk, dignity, equal human regard. This is an illustration from Jonathan Swift's book, Gulliver's Travels, which was written a century after the New Atlantis. These are Struldbrugs, or otherwise known as immortals, and they will live forever. Gulliver hears about them. They're among a people called the Lugnagians, because he's visiting all these different tribes. And he's so ecstatic because every theological treatise in the history of the Western world has said, you know, we're so potentially creative, we're so unlimited in our creativity, it's only fair that we live immortally. And so, this was basically the idea that somehow in this earthly life, we could live on and on and on and be creative. And Gulliver celebrates that until the king of the Lugnagians tells him that these Struldbrugs are hated by everybody because by the time they get into their 8th decade of life, they forget the common appellation of things. They have word finding difficulties. They lose the thrust of a conversation just a few seconds after a word has been said, and people hate them. They're the most mortifying sight I ever beheld, and the women more horrible than the men. My keen appetite, says Gulliver, for perpetuity of life, much abated. And then the king says to Gulliver, send a couple of these Struldbrugs back to your own country to arm your people against the fear of death. The idea being that death is a better fate than the self-effacement involved in a progressive dementia. Now, interestingly, Swift was a tremendous Christian advocate for people with dementia. He'd been on the board of Bethlehem Asylum in London, which was one of the first mental asylums in the Western world. And there, following the theories of Isaac Newton, they would actually throw apples and oranges, and they would prod the deeply forgetful with sticks, and they would leave them in the basement in the winter to freeze and shiver, because Newton had said that really one of the causes of mental disturbance was a slowing of the bodily fluid. So if you could speed that up, you would be helping these individuals, and people actually believed that. But not Swift. Swift was appalled by it. So he quit the board and he went back to Dublin, and he wrote a will in 1741 where he left all of his 12,000 pounds, the royalties from Gulliver's Travels and his other writings, to found St. Patrick's, a home and a hospital for people with dementia and other mental conditions. He himself, historians believe, succumbed to progressive dementia of one kind or another. He spent the last decade of his life kind of curled up in a corner of the St. Patrick's Cathedral. And he was a visionary. He wrote that you should only have people in St. Patrick's who are from the general vicinity of Dublin, so that their loved ones can come visit them regularly. They should be treated not with fear, but with care and compassion. And nowadays, St. Patrick's is still the most successful ongoing support system for the deeply forgetful across Ireland. You have satellites in every county, from Dublin to Donegal, and it's quite an amazing story. This is a shot of one of the cabin walls in an Irish ferry called the Jonathan Swift. Okay, I don't have that, but it talks about his particular sensibility for people with mental illness and disturbances, and especially for people who lost their memories. And that's the front entrance to St. Patrick's Hospital. That's the famous bust of Jonathan Swift that you typically see, in the beginning of his collected writings. What Swift was really warning against when he said these Struldbrugs are hated by all people, he was really warning against what I've called in my writings hypercognitive values, a term I coined, and there have been conferences on 4 continents about this particular concept. If you go to Germany in 1939 to 1941, there was a very horrid event called Tiergerstrasse 4, or T4 in Berlin, the name of a street. And basically 70,000 individuals, half of them it's estimated with cognitive developmental difficulties, and half of them with dementia, were taken out of these asylums, and they were left to freeze in vats of cold water in the icy winter, or lying out in the snow, or otherwise frozen to death. Then they would be brought back into the asylums, and they would be warmed up, thawed out, if you will, at different temperatures, in hot water and hot air, and so forth. And of course, that was completely outrageous. But what's interesting is that these were Aryans. These were not Jews or gypsies or gay people or people of color or Polish Catholics. These were basically pure blood Aryans, and they had something going against them, which was that they were not cognitively intact. And of course, that makes sense, because you had the movement in those days of human perfection along rationalist lines. Eugenics could be called. And Western philosophers have always said that it's linear rationality that defines personhood and makes a person protectable under the umbrella of do no harm. Dr. Leo Alexander, who wrote the Nuremberg Code, who was a professor of medicine at Tufts University, he suggested that the only thing to really help these groups, because they're so vulnerable, would be voluntary associations. For those who read de Tocqueville, Democracy in America, de Tocqueville thought that too. So voluntary associations, the Alzheimer's Association, the Spina Bifida Society, the Association for Retarded Citizens, et cetera, et cetera, et cetera, ALS. And I think that's really true, because unless you have these intermediate social institutions where people really advocate for these vulnerable groups, they are inevitably in trouble. And by the way, much research indicates that physicians in general today do have implicit and explicit biases. They view the worth of their patients as greater when their patients are cognitively intact. So if you have a cognitive disability, there is a strong possibility that you will not get the same medical treatment that someone else might. That's a long story. I won't get into it. This, by the way, is Leo Alexander's famous article, the most well and often read article ever in the history of medical ethics that everybody has to read. Otherwise, be careful around me, but Medical Science Under Dictatorship by Leo Alexander. Learning from my daughter, Eva Kitay's book. She was the founding mother of the ethics of care and is just retired from Stony Brook. We taught courses together in this field, the ethics of care, and how her whole ethics emerges from her relationship with Sesha, her daughter, who's severely cognitively imperiled. And then this very good book on the incredible tension between bioethics and disability. The bioethicists are talking about every kind of selective abortion for every kind of reason under the sun, about pulling the plug left and right. Whereas in general, the disability community is very much advocating for a disability group, and they are very hesitant to endorse the reduction in treatment or the selecting of these individuals out of our society. Cogito ergo sum, I think therefore I am. This is from the Portland, Oregon Alzheimer's Association. The idea here is that if I don't think rationally and in a linear fashion, I no longer exist, which is far, far from true. In 1995, I had the honor of being invited to the Indian Institute for Advanced Studies in Bangalore, and they had a whole conference on consciousness and deeply forgetful people. And so I gave a talk about how what's really important is not linear rationality, but rather consciousness. People can still enjoy music. They can enjoy the smell of fall leaves. They can enjoy so many things. They can be creative. They may not be linearly rational in the sense of laying down plans and operationalizing them, but they're rational in many other ways. And so in walked His Holiness the Dalai Lama, because he apparently hangs out there, and he put his hand down on the table and he said, yes, there's no reason to respect someone with linear rationality any more than someone who is not strong in that sense, or in fact has a strong memory. So I actually have a beautiful personal letter from His Holiness up on my wall here, which I won't show to you, but it was very meaningful. So why do I talk about deeply forgetful? I really wanted to change the language game of this whole field. That had an international meeting, Alzheimer's meeting on deep forgetfulness 2 years ago. So dementia is an entirely negative term. It captures a decline from a former mental state, dementia, and it's often used derisively, right? You want to put someone down, you say, oh, he's demented or she's demented. Whereas deeply forgetful is a term of inclusivity. We're all subject to moments of deep forgetfulness. By the way, in early February, I actually slipped on the ice out in the parking lot here at Stony Brook, and I hit my head, and I had a light concussion for, I think, a couple of days, but I still was working around. And I went to go home that evening, and it's okay to forget where your car is parked, okay? But it's not okay to forget that you have a car that's parked. So I actually asked a medical student, do you know if I drove to work today? They laughed. And eventually I saw my car. But this is a term of inclusivity, and there's even a mystery to it, because underneath the communicative chaos or the silence, that veneer, maybe there's a lot more there than we think. And so also in 1995, I coined a term called paradoxical lucidity, because with my own grandmother, but with many others, many others, I experienced people who were otherwise considered gone, husks, absent, dead, shells, whatever. But suddenly they sort of come back into themselves. And that really struck me as being paradoxical. It came to be called terminal lucidity, but it's really the paradoxical nature of it that struck me. So deeply forgetful suggests that mind and self-identity are present despite neurological adversity. Okay, that is my personal viewpoint, and I base that mainly on experience. This raises all kinds of questions for you philosophers about what is mind. This is Thomas Nagel's book, Mind and Cosmos, Why the Materialist Neo-Darwinian Conception of Nature is Almost Certainly False. I would actually say it is certainly false. That he does not think that you can derive mind from matter, and all the great spiritual traditions worldwide put mind before matter, that matter is actually derived from mind. In the beginning was the word, in the beginning was mind. The Hindus believe that, that the Big Bang came out of a mind, a divine mind that was beyond time and place. And so what is mind? This raises a lot of interesting questions. Now, I'm going to show you a little video from Rudy Tanzi, a Long Islander who's now the Rose and Joseph Kennedy Professor of Neurology at Harvard University, and with whom I've worked on many projects. It's a really powerful piece, and he's no kook. Let's see how this works. Is that good? Oh, okay.
The events of terminal lucidity, even in Alzheimer patients who are barely conscious, who are barely responsive, before we get them all the time. How suddenly a patient can, just before death, say their goodbyes to their loved ones, and remembering their names, maybe recalling an event after a decade or so of not learning, having lost first their short-term memory and then their long-term memory. Complete mystery. Somehow, just before death, they're tapping into, I think, the web of collective consciousness, where they can once again, with what they have left, with those few synapses they have left, they can tap into it, construct it, get it out just before they die. Don't really know how that's happening. Scientifically, we won't know for a while, but it's undeniable that it happens. It's amazing.
Okay, now. Oh. Okay, so a beautiful article came out just 2 years ago, Paradoxical Lucidity, a paradigm shift for the neurobiology and treatment of severe dementias, unexpected cognitive lucidity and communication in patients with severe dementias, especially around the time of death, but that's actually overstated. It can happen in more broadly, have been observed and reported anecdotally. Here we review what is known about this phenomenon, related phenomena that provide insight into potential mechanisms, ethical implications, and methodological considerations for systematic investigation. It's very powerful stuff. So I went with one of my friends, Dr. Joseph Foley, who was a well-known neurologist, to a geriatric psychiatric institute in Mount Vernon, Ohio, once upon a time, some years ago. And there was a unit for people, believe it or not, with mainly Down syndrome and who had gotten into their 50s and 60s. And they were being cared for meticulously by a community of Hindus who happened to be living in the vicinity for this purpose. And so Joe and I were astonished, and we took 4 or 5 of these Hindu nurses and one doctor, some nurses' aides, to nearby Gambier, Ohio, to a pizza restaurant, the only restaurant they had. And we asked them why they were so caring. And they said, Namaste, which I think you all know means I honor the divine in you as you honor the divine in me. I want to talk about it in Judeo-Christian language, that's image of God language. Now, this gets really interesting. So a couple of years ago, finally, after a lot of petitioning, some by me, the National Institute on Aging finally released 2 funding opportunity announcements to establish the building blocks of a research program on paradoxical lucidity. They realized the potential challenges of conducting such studies are matched by the potential opportunities to open a novel window onto our understanding of dementia. Initial findings from this research may eventually lead to studies that uncover novel mechanisms underlying cognitive decline. I'll stop here, but let's just say that at Harvard right now, the main area of research in dementia is on paradoxical lucidity using PET scans and other kinds of interventions. It's very difficult logistically, but how can we learn about these moments of lucidity? And if we can learn about them, could we actually get more of a handle on how to treat this illness? Now, Leonard Copeland, a lot of you are Leonard Slatkin was the conductor of the Detroit Symphony, but Aaron Copland was the great composer of Appalachian Spring. Let's see if we can get this going.
Several people went to visit Aaron Copland at his home in Peekskill, New York. They included the conductor Murray Sidlin and music historian Vivian Purvis. They went there to try to get Copland's permission to make a chamber version of this one grand opera called The Tender Lad. At this point, Copland was in the severe stages of Alzheimer's disease. He would die a little over 2 years later, but he was unable to communicate verbally. Nonetheless, this group, as well as others, were constantly visiting, telling stories, talking about his music, about his influence and importance in this country. On that day, Copland suddenly rose out of his chair and he walked over to the piano and he played these 6 notes. Those notes, those 2 chords, form the basis of Appalachian Spring. They're heard at the beginning, throughout. And those chords are the last we hear in this piece. What was Copland trying to communicate? Perhaps it was simply to tell everyone that he was still here. Or perhaps he was saying, this is what I want you to remember of me. Appalachian Spring by Aaron Copland.
We can't listen to this. Okay. So Aaron Copland, so long as the human spirit thrives on this planet, music in some living form will accompany and sustain it and give it expressive meaning. And for him, he understood the power of music really to the very end. Another vignette of paradoxical lucidity. This from a talk that I gave at the Time Center in Manhattan some years ago with Olivia Hobelzell, who then emailed me later on. And she talked about her mother who had severe Alzheimer's. And she said, in that late stage when words are gone, except for those very occasional moments, she looked at me intently and she said forcefully, God, physics, and the cosmos. There you go. Now I want you to see this. This is all going on right here on Long Island, just down the road, the Music and Memory project, and I've been very involved with it from the get-go. But this is Henry. Okay, watch on YouTube. Let's hope.
Over the age of 50, cheese can leave a permanent mark on the brain. As a brain and memory specialist, when my patients ask me what they can do to improve their memory, the answer is always the same. The fastest way to improve memory is to avoid certain foods, specifically foods that contain an enzyme called diacetyl. Diacetyl is put in many of today's processed
What should I do with
add
this?
flavor. These flavorings have a strong impact on the brain, and they can make extremely bland food taste amazing. The diacetyl often passes through the blood-brain barrier, leading to plaque forming in the brain.
Second.
This is often what causes memory decline. It's not actually all.
There, okay. We'll be okay now. Sorry about that. Okay. So let me go back to Henry, because I do want to show this to you. Okay. Here's Henry. Did it again. Ah, this is it. Okay. Can you see that? You
I
can't.
have one resident that barely opened her eyes. She didn't respond. As much as I tried, I knew her for 2 years. No matter what I tried, massage wouldn't work, nothing worked. But when we got introduced to the iPods and the family told me the things that she liked, it was amazing once we put the iPod on her. She started shaking her feet. She started moving her head. Her son was just amazed. Okay, can we stop? Because now I'm getting no arm. I'm seeing her all over again.
Can you see this?
Okay. I don't see it. How you doing? All right. Great. Going on? Loving, singing, every occasion he would come out with a song, no matter where he was. I remember as a child, he used to walk us down the street, me and my brother, and he would stop and he would sing in the lane. He would have us jump in and swing around home. He was good. He was always into music. Fun-loving, singing, every occasion he would come out with a song, no matter where he was. I remember as a child, he used to walk us down the street, my brother, and he would stop and just singing in the rain. He would have us jumping and swinging around home. So he was always into music.
You first see Henry inert, maybe depressed, unresponsive, almost unalive.
Henry.
Yeah.
Henry.
Yeah.
Or religious music for him. Because he plays music and he always quoted the Bible. I'd rather have that for him.
This is the checkers game where Grant's
unresponsive and almost unalive.
There. Can you see that?
Henry.
I've done your music. You want your music now? Okay. Let's try your music, okay? And then you tell me if it's too loud or not.
Then he is.
That's Oliver Sacks, the neurologist,
Favorite music.
who did Awakenings and The Man Who Mistook His Wife for a Hat.
And immediately
he lights up. His face assumes expression. His eyes open wide. He starts to sing, to rock, and to move his arms, and he's being animated by the music.
And he used to always sit on the unit with his head like this. He didn't really talk to much people. And then when I introduced the music to him, this is his reaction ever since.
Philosopher Kant once called music the quickening art, and Henry is being quickened. He's being brought to life.
Yeah.
I'm going to take the music for 1 second, okay? Just to ask you a few questions. Okay?
Stephen, just tell me when you want me to stop
I'm
playing.
going to give it back to you.
About 2 minutes.
The effect of this doesn't stop, because when the headphones are taken off, Henry, normally mute and virtually unable to answer the simplest yes or no questions, is quite voluble.
Henry,
Yeah.
do you like the iPod? Do you like the music you're hearing?
Yes.
Tell me about your music.
I don't have none, my man.
Do you like music?
Yeah, I'm crazy about music. You play beautiful music, beautiful sound. Beautiful.
Did you play music when you were did you like music when you were young?
Yes, I've been to big dances and things.
What was your favorite music when you were young?
Well, I guess, well, Cab Calloway was my #1 fan guy I like.
What was your favorite Cab Calloway song?
Oh, I'll be home there for Christmas. Oh, you can count on me with plenty of snow, mistletoe, present, reverend you tree. Ow.
So in some sense, Henry is restored to himself. He has remembered who he is, and he's reacquired his identity for a while through the power of music.
What does music do to you?
Give me the feeling of love. No man, figure right now the world needs to come into music, singing. You got beautiful music here. Beautiful, oh, lovely. And I feel the band of love, dream. Lord came to me, made me holy. I'm a holy man. So he gave me this sound. So I just say, I meet
I
you.
think that's okay. Yeah, we'll go back to the presentation. Thank you. Thank you very much. And now, can you see that? Can you see that? Yes, yes?
No, not yet.
Okay, now let's see how I do this. And so how do I get to share screen? Let's just see. Wait a minute. How about this? Okay, wait a second. How about that?
Yep, there you
can
go.
see it. Okay. So let's go here. Slideshow. We'll just present from current slide. Okay. Yeah. So actually, the reason I show this to you is because it's more important than anything else that could be said about ethics and the deeply forgetful. They may not measure up to hypercognitive philosophies of personhood, but to use an expression from Larry Dossey, you have to be a noticer, you have to listen, you have to hear the whispers, you have to catch the winks. These are people who can be amazingly creative. I won't even go into this, who have symbolic rationality, who have emotion, relationality. They love dogs, mirth, somatics like Henry, music and rhythm. They come into themselves. They love beauty. They can have smell and taste, spirituality, grabbing a rosary bead right to the end, or chanting Nam Myoho Renge Kyo with their last breath. Touch, consciousness, continuity of self-identity. This is the great abstract expressionist Willem de Kooning. He painted with such anxiety. He was diagnosed with probable Alzheimer's disease and spent the last 14 years of his life in the loft in Greenwich Village with an assistant. And he would just rise up sporadically wearing his dungarees because he knew he was an artist. And he would dip his brush in paint, and he'd go up to the easel and he would paint. When he died, there was a posthumous exhibit of his work at the Museum of Modern Art. And the bad critics said, well, he was empty, he was gone, he was a husk. But the one I liked from the New Yorker said, wait a minute, here's a man who had Alzheimer's disease probably for 14 years. And for 13 and a half years, he knew he was an artist and he painted. And in my view, this later work of de Kooning's is in some ways refreshing. It's a little better at some level than his earlier stuff. It's not as anxious, it's freer, it's a little more uplifting. Tactile and relational, dogs to the rescue. I was on the board of Alzheimer's Scotland for many years, and we initiated the Alzheimer's dog movement worldwide. It's now in 37 countries. We wanted everyone in Scotland to have an Alzheimer's trained dog. And some years ago, I was giving a talk in Brooklyn, and a woman who heard about the dog movement wrote me this email. Bringing Lola to see Alzheimer's patients has made a tremendous difference in helping me open up the line of communication. Take Marvin, he's 91, he lives at home with his wife, he's got advanced AD. He has a full-time aide and he sleeps in his own room with his wife. Well, his wife has the master bedroom. Marvin had walked into her bedroom and fallen asleep on the bed since the morning. The aide and the wife couldn't get him up. I walked in the room with Lola, put her paws up on him and said, Marvin, get up. Look who came to visit. Marvin popped up excited to see Lola. I was able to lure him out of bed and into the family room where his wife was. He couldn't contain his excitement. His wife and the aide couldn't believe it. Lola brought back his memory of his dog, Sparky. So some years ago, I happened to be in Sydney, Australia. We did a whole 2-day event, which was in all the newscasts and all on the dementia dogs. And we had about 120 people with dementia walking down the main drag of Sydney with their dogs. And they were so happy and it was so beautiful. And they were getting so much out of their relationships with their dogs. This taxi driver pulled over and he looked at us and he said, what's this? Blimey, dogs are only for blind people, which kind of shocked me. And I guess we needed an Alzheimer's dogs movement in the United States. It makes such a difference. Symbolic rationality, de Kooning's brush, Jim's twig. I was in a nursing home in Chardon, Ohio, and I read a little bio sketch about a guy named Jim. He had 2 kids, 2 adult sons. And this was in a special care unit. I asked the nurse to show me Jim, and I went over to Jim and I walked him over to a table and I asked him about his sons. He couldn't respond at all. He was conversationally gone. But then he had a twig in his hand, a white twig, and he put it in my hand. And when he did that, he smiled. And if a smile was electric, the place would have been on fire. And then he said 3 words. He said, God is love. And I couldn't believe it. I put the twig back in his hands. And I went to the nurse and I said, tell me about Jim. She said, well, when he was a boy, he grew up on a farm and he loved his father very much. And like, a good half of these people, he'd gone back to whatever it was symbolically that he associated with tender, loving care and attachment. And so his father had given him a chore every morning, which was to bring kindling in for the fireplace. And that's where he was living. So you really have to notice these people. That's the ethical job, is to notice them. Hope, what is hope? Hope is different in every illness condition. My definition of hope is being open to surprises and noticing the continuity of selfhood. And this is especially inspiring for caregivers. Look at that woman in the video of Henry, how inspired she was when she realized that Henry was still there underneath the chaos. And by the way, how often is that the case? 70% of individuals with whom we do nationally now, music and memory interventions with personalized music in the iPod, they actually do come back into themselves for a period of time. There is an 80% reduction in the use of psychotropic medications, behavioral medications, because somehow in that getting connected with who they are, the confusion, the buzzing, the beeping world around them that's so difficult for them to manage, they're able to handle it better. And so now this is being funded. Actually, Alzheimer's Canada is giving everybody who's diagnosed with Alzheimer's an iPod. So is the state of Ohio, state of California, and 15 other states. Okay, so this is a big deal. We're studying it in 4 different states, and what we're finding is that by doing music and memory interventions, we reduce the need for feeding pigs by 90%. In other words, people remember through this process, they remember how to swallow and eat. So how to communicate, talk evenly, even to the most cognitively disabled, calling them by name, speak with a warm and calm voice, a joyful facial expression, bending down to make eye contact, communicating with them rather than around them. So they pick up on these things. They pick up on kindness. Currently, really quickly here, there's no intervention that can prevent this illness. There's really no pharmacological intervention that can help. All the dreams of a world without Alzheimer's, we may get to that, but this is from 1997 at the national meeting. We haven't. The cholinesterase inhibitors do very little. Pharma is really confused. No one knows quite what to do. And the one new medication, Biogen's aducanumab, was turned down by the FDA with a special panel, 0 in favor, 10 against, 1 uncertain in November 2020. And that was the most hopeful thing on the horizon. Okay. By the way, Johns Hopkins, what are they doing? They're taking these music and memory type moments, which they can induce, and they're studying them and trying to find out what part of the brain is engaged in those moments. And then they want to use deep brain stimulation and see if they can turn that on more consistently. I'm going to not go through all this, but diet might help. Meditation seems to be important. 20 years ago, neurologists didn't think that meditation helped, but now they do. In fact, the majority of neurologists will tell you that stress creates hippocampal atrophy, which is a marker of Alzheimer's. And so by meditation and maybe other spiritual practices, you can limit stress, and that can be a very good thing. I'm going to skip through this and just say, interesting study on purpose in life out of Rush Presbyterian in New York, and this has been replicated 4 times. Take older adults, the ones who have a strong purpose in life, shown on a purpose of life scale, had a 30% lower rate of cognitive decline, the high purpose quartile than the low quartile. And this appeared in Archives of General Psychiatry. So there are all these sort of pragmatic, what I call quandary issues, research ethics, autonomy, restrictions on driving. I'm not going to go into this, advanced planning, susceptibility testing. But I will say something about pain very quickly, that now at last, people are accepting the fact that people with Alzheimer's disease can have underlying pain, that it's not just an artifact of the Alzheimer's itself. And so they're being treated accordingly. Pain AD is this great scale that we're using, was developed by people at the University of Chicago in 2000, where you can actually begin to get very good at picking out the pain that people are experiencing. As far as choices go, you look at older adults, 95+% say if they got into a condition of advanced Alzheimer's or dementia generally, they would want no life-extending intervention whatsoever. They would even not want to be continued with treatment for diabetes or heart failure or whatever. As far as assisted oral feeding goes, that's the way to go. I did that with my grandmother post when I was a much younger person. You see this is a mortality curve. People who get assisted oral feeding are living longer than the ones who get a feeding peg. So a feeding peg is not a panacea. I won't go into this. Exclusionary policies, well, again, we don't have time for this, but I will tell you that preemptive assisted suicide for the deeply forgetful is going on in Europe. It's going on in Quebec. It's legal actually in Quebec. This means while people still have the capacity, they'll take 40 secanols that are prescribed to them by a doctor and mix them into a milkshake and gather together with their loved ones by the fireplace and play Johann Sebastian Bach. And that's it. I don't support this kind of thing. I'm not an advocate, but in a couple of cases in Ohio, where the doctors were willing to do the prescribing, but they weren't willing to be there on the site, families asked me, in one case tearfully, if I would actually be there just as a presence, and I was. So I witnessed this actually more than a few times. And that's a big question for the future of medicine. What are we going to do with these people? This is the Jonathan Swift, where the writing on St. Patrick's Hospital came from. That's a book it's now outdated, but the new one is going to be the title of this talk. Again, Dignity for Deeply Forgetful People. The way we do medical humanities here, which is caught on at the Cleveland Clinic in Columbia and elsewhere, we start with the illness experience, the humanities, the poetry, the short stories, the narratives, the music, the art, the Henrys of the world. And we hope that that will elicit humanistic virtues in our students, our medical students, humility, empathy, integrity, resilience. And then from that, they can interact with compassion and psychological skill in the clinical setting. And so last year we were awarded by Alpha Omega Alpha, the National Award for Professional Identity Formation of all medical schools in the US. And this is the model that we utilize. Just FYI, it works, it makes a difference. And just one little comment that we do have more students going on to residencies who are being invited to become chief residents per capita than any medical school in America. Because these subtleties really matter. That's what healing is about. Okay, I'm done. I'm going to stop share. Okay. We have about three minutes. Sorry about that, Dr. Stahl. Yeah.
Great. Well, so if you have a question, I think it's perfectly fine if you just want to unmute yourself. But we already had one question in the chat. So Jana asks, so there's a good deal of Alzheimer's disease that runs in my family, and I have some amount of fear that I may someday have this condition as well. Would this fear come from an overemphasis on hypercognitive values? Is this something you would be afraid of developing or something that you've been able to accept?
Well, if you have a first-degree relative who's been diagnosed with probable Alzheimer's, you are at a slightly higher risk. So by age 80, instead of having about a 15 to 20% risk, you probably have a 25 to 30% risk. So it's a little higher. And you just know that by family history, basically. Now, we actually did a study in the New England Journal of Medicine on apolipoprotein E4 allele, the double E4 allele. Does make people almost entirely likely to have the disease in their very old age. But the problem is we don't know when. That could be when you're 120, or it could be when you're 100 or 90 or 80, so it doesn't really do you much good predictively. And most people really don't want the test. They just, but a family history is all you need to know. And so if you have that and a first degree relative is either a mother, a father, or a sibling. Nothing else matters. You could have lots of other people in your larger extended family that really wouldn't be relevant. It's the first degree relatives that can make a little difference. But even then, nothing's predictive. And so I wouldn't worry too much about these things. Just live your life. I would suggest, healthy aging because the vascular side of this is significant, especially in the mixed diagnoses. So, have salad and get some exercise, spend time with friends, so, interact socially, and so forth.
Hi.
Hi.
I really liked your presentation. I've been like really interested in this topic for a while. And I wrote down a question because while you were discussing the Henry's story, it kind of reminded me of something else, and I wrote it down because I kind of tend to crack under pressure in these situations. But so I know savant syndrome can be acquired oftentimes through central nervous system injury.
Yeah.
Do you think there's any connection in brain function between savants and patients who experience this sort of like paradoxical lucidity like Henry? And do you think it's possible that all humans are born with this dormant potential?
That is too much for me, but I suggest that you ask Dr. Levin about that on another occasion, because it's a beautiful question. I think there's a lot more than meets the eye. I have never allowed myself to tell anybody that their grandmother is not there, that she's gone. I've always said, at least be agnostic. Maybe there's something more there underneath. And that's so important, because that's the beginning of ethics. There is no ethics if you write people off as gone, right? So there's something going on there that's deep and even profound. And sometimes it just comes to the surface, and that's salvation.
Great, thank you.
Yeah, I gotta go because I have a class that started 2 minutes ago.
Well, would it be okay if people emailed you with more questions, Dr. Post?
Yeah, email me. Yes, Dr. Stahl will give you my email, and I'd love to get your questions by email, and I'll look at them tomorrow morning.
I'm sure they can find you at Stony Brook's website, right?
Yeah, but just Stephen with a ph.post@stonybrookmedicine.edu. Okay, just to save yourselves. Okay.
Thank you.
Thank you.
Thank you for having me. It's an honor. Really.
Thank you.
Thank you, Dr. Levin.
Thank you.
Okay, I'll see you. Bye-bye.
Thanks.